Physician Assistant Gerald Brown, our guest today. We're talking about chronic cough. The first question is, what is a chronic cough?
Chronic cough is one of those elements or one of those symptoms that we see quite often that normally lasts about 8 weeks or more. Cough is broken up into about three different periods of time. Less than 3 weeks is an acute cough, normally from a cold, short-term allergies. It can become an acute chronic from 3 to 8 weeks, and then after weeks it's considered chronic.
What are the causes of chronic cough?
A lot of different causes. The most common that we see has to do with environmental. Smoking is probably the #1 reason why folks have a chronic cough. Others are allergies, postnasal drip, things that are in the air, toxic chemicals can cause a cough, dust.
Are there risk factors for chronic cough? You may have segued into that.
Risk factors for cough include smoking. The longer that an individual has smoked, or the more that an individual has smoked and the longer that an individual has smoked can cause an increase in cough. Others is just the environment that you live in. Being in East Texas, this has been a very bad allergy season for us. We see a lot of folks coming in with cough. Other causes of chronic cough can also be gastroesophageal reflux disease, GERD. Patients that have a reflux can also develop a cough that lingers.
What complications can persistent coughing cause?
In rare instances, persistent cough can cause a pneumothorax or a collapse of the lung, and it can be a life-threatening emergency. Other instances, it can cause microhemorrhaging of the pulmonary tree, causing blood in the sputum, can increase infections.
How do you treat it?
Cough is treated in many ways. First of all, you find out what the cause is. If it's smoking, we recommend patients to quit smoking. Environmental factors to include allergies, we'll treat with over-the-counter decongestants, we'll treat with antihistamines. If it's caused by reflux, we'll put them on either a proton pump inhibitor or an acid blocker that helps to reduce acid secretions. Recommend not eating any closer than 4 hours going to bed, elevating the head of the bed at night.
You mentioned this just a second ago, but let's amplify. How effective are over-the-counter cough drops and liquids and things of that nature in treating chronic cough?
They can be very effective. Guaifenesin, which is found in over-the-counter Mucinex, cough suppressant, Robitussin, helps to liquefy the secretions that you get with a chronic cough, helping the body to be able to handle them much easier. Over-the-counter cough drops also help quite a bit in maintaining the moisture in the oropharynx of the throat, helping to also to handle the secretions much easier. There is an over-the-counter cough suppressant called dextromethorphan, or abbreviated DM, that does work on the cough center to help suppress cough.
Aside from not smoking, which you mentioned, other things that we can do to prevent chronic cough?
Maintaining healthy environments. For an acute care cough, washing hands, normal hygiene. For the chronic cough, if you have allergies, take your medication. Other things that may cause it, other things that may also contribute to the cough is medication. ACE inhibitors, drugs that we use for high blood pressure, one of the side effects is a cough. If that is the case, we'll take patients off and rearrange their blood pressure medication.
Are there any home remedies or other comfort measures that can help with a chronic cough?
Some of the home remedies that have worked in the past include honey and lemon, a boiled solution of sugar with cloves, drinking or sipping that throughout the day. Over-the-counter medications do help quite a bit also.
When is a chronic cough more serious than just a cough?
It becomes more serious the longer that it lasts. There are some elements, or there are some causes of cough that are more serious, such as tuberculosis, sarcoidosis, and even lung cancer, that need to be investigated by a healthcare provider. We usually will do a chest x-ray to start the workup.
At what point do I start thinking I need to see a physician because my cough has lasted so long?
Cough lasts more than about 6 to 8 weeks. It's probably time to be seen either in an acute care environment or more preferably with your primary care provider.
Very well. Thanks for your time today.
Thank you.